Joining us now, Republican Senator Roger Marshall, who's a member of the Finance Committee. I don't know if it's been a while, at least, Senator. It's good to have you on. And as I said, I'm from the great state of Kansas. I used to drive across 4 times a year, going to school out in Colorado. So anything on I-70, I've probably been there, whether it's Hayes or Russell or home of Bob Dole. Good to have you on. Thanks for joining us.
It's great to be on. Where my home is just about 30 miles south there of Russell, Kansas. So you're familiar that we're a state of agriculture. Have a little bit of oil as well, though.
You do develop an eye for Kansas, especially when you drive across it enough times. You better, because it's a big state, Senator. So a lot was riding on this week. The most important parts of this bill, the Medicaid parts, the tax parts. We had Senator Johnson on, and I got to tell you, if it wasn't for the constraints of who's in the Senate and who wants certain things, I can see how we'd want to get back to pre-pandemic spending levels. I understand that rationale, but it's not going to be possible with this bill, is it?
Not yet. I think that's a great goal. Senator Johnson certainly recognizes, like I do, the greatest challenge that America faces is our national debt. But the purpose of this bill is to, number one, is to prevent the largest tax increase in American history. We think that by stopping that tax increase and other provisions, that the average American family is going to get to keep $1,000 a month more of their hard-earned money. It's obviously going to secure the border. It's going to cut $1.7 trillion in spending. So this is a step in the right direction. Rome wasn't built in a day either. So the first thing we have to do is grow the economy. We need to flatten spending, and over the next 4 years, get to those pre-pandemic spending levels. I think it's very feasible. We'll take a bite of the apple now. We're going to have to take a couple more bites as these next 3 years go along, though.
The House was able to slightly toughen up some of the Medicaid reform. At least they brought back the work requirements a little bit. But as it's been pointed out so many times, some of the main flaws of Medicaid are not addressed in that bill. And because of the makeup of the Senate, probably not going to be addressed there either. You're an expert. You're a doctor. What should we do? What are we able to do?
Well, look, we need to strengthen and preserve Medicaid for those who need it the most. As a physician, as an obstetrician, we took care of everybody regardless of their ability to pay. And I want everyone to have meaningful access to primary care, and Medicaid provides that. So we're certainly not going to touch seniors. We're not going to touch people with disabilities. Again, we want to impact those who need it the most. On the other hand, we have 7 million healthy American men of working age who aren't working. Let's help those people find a job, help them get off Medicaid. Let's help them either get on the ACA exchange or maybe health insurance through their employer. That's a win-win opportunity. The best safety net out there is a job. So I'm trying to look for that. You can't look at this in silos, but I think that would be my goal, is to help those people that are on Medicaid, that are on food stamps right now, that are working age, they're healthy. Let's help them find a job as well.
Is there a path to that with I don't know, Josh Hawley or Susan Collins? Or what would have to change in the House version for you to really tackle that issue?
Look, I think the House did a really nice job. I think that we need to sync the work requirements between the House, between Agriculture Committee, that would be the SNAP provisions, and then Medicaid as well. I think we can move them up maybe 6 months to start them sooner. But I really think it's the economy. If we have a growing economy, we're going to help move those people from the couch out to work as well. I think that's one way to do it. I think the big problem with Medicaid right now, though, is that we've increased spending 50% in 5 years. So we need to figure out, how do we slow down that spending? In many states, they've figured out ways to gin the system that we are reimbursing hospitals more for Medicaid patients than Medicare. So we need to go back and look at this provider tax and make it fair at the same time. So if you're building your hospital on a model of Medicaid patients, you're going to go broke. Like you said, I was a physician. I also helped run a hospital. Growing your business or making a business plan on Medicaid is not going to work. We need the people off Medicaid and move them into the exchange or move them into a job where they get health insurance.
Although, Senator Marshall, that's exactly what Josh Hawley and Susan Collins and others have pointed out. They are very worried about hospitals in rural areas that they represent, saying that there will be no hospitals left. And by the way, a lot of hospitals run at incredibly thin margins, 1-2%. You are not talking about a super profitable business for the most part. The reality of that is going to come up against a very hard wall. How do you get around some of those issues? How do you solve for that?
Yeah, so no one knows more about rural hospitals up here on Capitol than I do. I'm the only person that's actually ran a hospital and a rural hospital at that. There's efficiencies that many are not doing. But at the end of the day, we have something called critical access hospitals. They function on a system of Medicare Plus. So those would not be touched with this situation as well. I would make immune nursing homes from this provider tax cut as well. That's such a small amount of money to keep those rural hospitals going. There's other ways to do that. And certainly there's other systems, there's other funding, other mechanisms that they get because they are rural as well. Things are changing in rural America every day. I would love to come back and talk what the rural hospital of the future looks like. It's probably a really good emergency room with good outpatient services and go from there.
Another question for you. Yesterday we had Jason Smith, the chairman of the House Ways and Means Committee, with us. He talked about fatal provisions that he said the Senate is aware that if they change some of those provisions, it will not survive the House on coming back through. Now, he didn't specify on what some of those things are. We know SALT has been a big issue, the Medicaid, as you've just been discussing. And I heard him, Jason Smith, talking overnight about some other issues. He said that there are some senators who want to make the small business tax cuts permanent, and they want to do that and pay for that by not including taxes on the tax relief on tips or overtime that the president has suggested. He seemed to suggest, Jason Smith, that is a fatal provision and that will not survive. Where do you come down on that?
Look, everyone's negotiating through the press right now, and everything is negotiable. Look, we're going to get the no tax on tips, overtime wages, Social Security across the finish line in some shape or form. On the SALT tax, my goodness, why should red states be subsidizing blue states to the tune of about $400 billion over the next 10 years? I think there's a sweet spot for us to land on, and we may very well do a bill, send it to them. They may reject it and send us a bill back. We're not going home, though, until we get something to the president's desk. But this is what's going on. These are powerful negotiations. I've never seen such intense negotiations going on within the Republican caucus right now. There's hundreds of billions of dollars at stake. The future of this country's at stake. It is very interesting times up here.
We'll have you back. We want to talk about your credit card bill. And I was just looking at, you went to KU for medical. Were you a Hawk guy or a Wheel guy in terms of the bars in Lawrence? Did you have a preference?
Well, first of all, I went to Kansas State for my undergraduate, so I bleed purple. KU Med Center, fortunately, is in Kansas City. And actually,
it is not in Lawrence. Okay.
It's not. And 2 years in Wichita, but love KU basketball and the Will. The answer is the Will, going way back to my own parents going there. So it's a great, Lawrence is an incredible town, too.
It's a great college town, and maybe one of the best arenas, too, if you like hoops. Senator Marshall, appreciate it. Thank you very much.
Come visit us sometime. Yeah, come visit us.
Come back and talk about rural hospitals, too. I would like to hear more on that.
Yep.